RSV Academy. Questions about RSV. The size of RSV problem in adults compared to children.
Hi everyone, I'd like to briefly go through some data related to the burden of RSV and issues that we have had in the past in identifying and knowing the real size of the consequences of an RSV infection. It is known as a mild infection usually, with the presentation similar to what we have in flu or influenza. Is coughing, sneeze, fever, sometimes wheezing. It can be more severe with pneumonia. It can exacerbate pre-existing diseases, particularly the respiratory one, asthma and COPD, and it has been associated with acute cardiovascular events. What we know best, and we have known best for a long time, is the most well-characterized clinical expression of RSV infection in children, which is bronchiolitis, or more severe expression related to pneumonia. This is very well characterized, but the effect of RSV in children is not, and of these events, acute event, is not limited to the acute phase, though it can be very severe. We know that it is a risk factor of developing chronic respiratory conditions, particularly asthma. RSV infection in childhood is listed among the risk factor for asthma development, and it is associated, as many other infections by the way, to a lower development of the lung, the volumes actually of the lung, which means that they are at higher risk of developing airflow limitation. This is the frequency of RSV in early life. It's particularly high in the first months of life. Then other viruses are taking the lead, rhinovirus in particular. Though this has been well studied, and this the common way of thinking to RSV. That's not the entire truth. Actually, RSV is a common infection throughout life at any age. It can express with upper respiratory tract symptoms. Luckily, most of the cases are like this, but it can be severe, very severe, life-threatening, particularly with underlying chronic condition, either respiratory or cardiovascular, for example. Indeed, the mortality in elderly, in adult in general, is quite substantial in hospitalized patient, around 6 or more percent, and it's more frequent the severe infection in not only in elderly patient but in exposed patient, and those that are exposed to children are at higher risk. Then we can debate who is exposing and being and putting at risk whom. Immunocompromised patient and patient with defective immune responses, which is a common condition driven by different mechanisms of chronic inflammatory diseases, and I'm listing asthma, COPD, but also cardiovascular conditions. To give a figure, these are the estimated number in Europe. It's 3 million per year with detected infection. 1/10 around are hospitalized among adults more than 60 years of age. And it's impressive the number of estimated deaths associated with RSV. In adults more than 60 years, it's 20,000. So, although the best and the most studied condition is in children, in childhood, the number of severe cases requiring hospitalization and the number of deaths associated with RSV infection is substantially higher in adult patients more than 65 years than in high-risk children less than 5 years. Actually, the vast majority, up to 80% of RSV-associated deaths are occurring in subjects more than 65 years of age. As we mentioned, typically the infection is mild, cold-like symptoms. It can be severe, very severe, life-threatening, related to different clinical expression, let's say pneumonia or extensive impairment of the lung or other organ and system. This is more frequent in patients with concomitant condition. Here are listed the respiratory and the cardiovascular one. For reasons related to the fact that an infection in this case usually worsen the underlying clinical condition, so the expression is an acute worsening of the disease. This, for example, is COPD. It is an analysis of several studies where the frequency of viruses triggering exacerbation, most of them are severe exacerbation requiring hospitalization, have been done systematically. And after rhinovirus, RSV comes as second as the most frequent virus that trigger the exacerbation. And remember, most of the exacerbation are triggered by respiratory viruses. Then there can be a superinfection by bacteria, or it might be concomitant, but viruses are certainly the most frequent cause of exacerbation. This comes quite natural as a way of thinking of a respiratory viral infection. It is also well established, but more indirect, at least to consider it as a consequence of a viral infection or associated with a viral infection. The cardiovascular events, but the numbers are clear. These are myocardial infarction admission, where RSV infection is found quite frequently, 10% of cases almost, and in 4% of cases to stroke admission. But let's see the other way around. The patients, and the study has been done in Canada, that are having a documented RSV infection, there are at higher risk of cardiovascular events, severe cardiovascular events. These are acute myocardial infarction requiring hospitalization within 7 days after the detection of viral infection, and RSV is associated with 3.5 higher risk compared to patients non-infected with RSV to get in the 7 days after the infection an acute myocardial infarction leading to hospitalization. So it's broad. The figure of possible consequence of infection in elderly, certainly it's important, epidemiologically very relevant in all elderly patients, in particular those with comorbid condition that favor both the frequency and the more severe expression of the infection, in a way that it is usually the exacerbation of the underlying condition.